Hello, welcome back to Healthy Kit. Today we're tackling a subject that could save lives and protect futures: ovarian cancer, often called the silent killer. Here's a sobering thought. Many women miss the early warning signs, mistaking them for everyday issues like stress or aging. But what if those subtle signs, bloating, fatigue, or appetite changes, are your body's way of crying out for help? Ovarian cancer is stealthy, but catching it early can mean the difference between life and an uphill battle. This video is your wake-up call. We'll uncover 10 critical warning signs you need to know to stay ahead of this deadly disease. The next bright light. Don't wait until it's too late. Your health, your life, and the lives of those you love could depend on this knowledge. Stick with us as we break down these symptoms, what they mean, and how you can take action today. Before we dive in, hit that like button, subscribe to Healthy Care, and share this video, because awareness saves lives. Let's get started and empower ourselves against ovarian cancer. Says 10. Pain during intercourse. Pain during intercourse, medically referred to as dyspareunia, is another potential symptom of ovarian cancer that is often overlooked. This pain is typically felt deep in the pelvic region during sexual activity, and can range from mild discomfort to sharp, persistent pain that interrupts intimacy. The discomfort is often caused by the presence of tumors in the ovaries, which press against surrounding organs like the bladder, uterus, or vaginal walls. In some cases, women may also feel lingering pain after intercourse, or during routine pelvic exams, as the pelvic area becomes increasingly sensitive due to tumor growth. Unlike occasional pain caused by vaginal dryness, infection, or other temporary issues, the pain associated with ovarian cancer is persistent, unexplained, and may gradually worsen over time. It's not uncommon for women to dismiss or misattribute this symptom to age changes or minor gynecological issues. However, when pain during intercourse is accompanied by other symptoms, such as bloating, pelvic pressure, urinary changes, or menstrual irregularities, it could be indicative of something more serious. Paying attention to these symptoms and seeking medical advice promptly can lead to early detection, which significantly increases treatment success. If this type of discomfort becomes a recurring issue, don't hesitate to consult a healthcare provider. It could be a critical step in safeguarding your health. 9. Menstrual changes. Menstrual changes are one of the early warning signs of ovarian cancer, especially for women who have not yet reached menopause. These changes can manifest in several ways, such as periods becoming noticeably heavier or lighter, cycles turning irregular, or unexpected bleeding occurring between periods. Some women may experience more intense cramping and pelvic pain during their periods, while others notice pelvic discomfort outside their regular cycle with no clear explanation. These subtle yet significant changes are often mistaken for hormonal imbalances or natural fluctuations caused by stress or lifestyle factors. In more concerning cases, ovarian cancer can cause a sudden and unexplained cessation of periods, which can be alarming for women who are not approaching menopause. This happens because the cancer affects the ovaries, which are responsible for regulating the menstrual cycle. While changes in menstruation can also result from weight fluctuations, stress, hormonal birth control, or other benign causes, it's critical to monitor symptoms that persist or deviate significantly from your normal pattern. Ignoring these signs could delay diagnosis, reducing the chances of early treatment when it is most effective. If you experience unusual, persistent, or worsening menstrual changes, consulting a healthcare professional is essential for determining the underlying cause. 8. Changes in bowel habits. Changes in bowel habits such as unexplained constipation, diarrhea, or alternating between the two, can sometimes signal ovarian cancer. These disruptions occur when a tumor in the pelvic area presses against the intestines, interfering with their normal function. You may notice more frequent or less frequent bowel movements than usual, harder or looser stools, or even the feeling that your bowels aren't completely empty, even after using the restroom. These symptoms might seem mild or temporary, making them easy to overlook. However, when these changes are persistent, appear suddenly without a clear explanation, and are accompanied by other symptoms like bloating or pelvic discomfort, they warrant immediate medical attention. While factors like diet, stress, or irritable bowel syndrome, IBS, can also cause bowel changes, their persistence, combined with other signs, could point to something more serious. Early detection of ovarian cancer significantly improves treatment outcomes, so it's crucial to act quickly if you notice a consistent shift in your bowel habits. These changes might feel minor at first, but they could hold the key to saving your life. 7. Back pain. Back pain, particularly in the lower back, is a symptom that many might dismiss, but it can sometimes be an early warning sign of ovarian cancer. Unlike typical back pain caused by poor posture, muscle strain, or prolonged sitting, this discomfort tends to persist and lacks an obvious cause, such as an injury. The pain is often due to the growth of cancerous tumors, which press against nerves or other structures in the back or pelvis, creating a unique and unrelenting discomfort. In some cases, fluid buildup in the abdomen, a condition known as ascites, can exert pressure on the spine, adding to the pain. This back pain often starts as a mild ache, but it can worsen over time, becoming more severe and harder to ignore. What makes it particularly deceptive is its similarity to common back issues, leading many to misattribute it to something minor like arthritis or muscle tension. However, when the pain is persistent, doesn't respond to standard remedies, and is unrelated to any clear cause, it's a red flag. Paying close attention to these patterns and seeking medical advice promptly could make a significant difference in early detection and treatment. 6. Fatigue. Fatigue is one of the most common symptoms experienced in various illnesses, but the type of fatigue linked to ovarian cancer is often extreme and unrelenting. This isn't the usual tiredness that follows a busy day or poor sleep. It's a profound exhaustion that lingers, regardless of how much rest you get. Even after sleeping longer than usual, you might wake up feeling completely drained and incapable of tackling your day. Tasks that once felt effortless, like climbing a flight of stairs, grocery shopping, or even standing for extended periods, may now seem daunting or impossible. This overwhelming fatigue occurs because the body is working overtime to combat the cancer, using significant energy to fight off the disease and manage the physical stress it causes. Additionally, ovarian cancer can lead to anemia, a condition marked by a decrease in red blood cells, further reducing the oxygen supply to your tissues and exacerbating tiredness. The combination of cancer energy demands and anemia can leave you feeling perpetually exhausted. While fatigue is often caused by factors like poor sleep, stress, or common medical conditions such as thyroid issues. The key difference is the severity, persistence, and unresponsiveness to rest. If you find your fatigue worsening over time, becoming constant, or accompanied by other symptoms such as bloating, abdominal pain, or weight loss, it's crucial to consult a healthcare professional. Fatigue might seem like a minor inconvenience, but it could be an early and important signal of ovarian cancer. Early detection and intervention can make a life-saving difference, so don't ignore this symptom if it persists. 5. Unexplained weight loss. Losing weight without trying can be a warning sign of ovarian cancer, especially when it happens rapidly and without a clear reason. This type of weight loss is often linked to a loss of appetite and feeling full quickly, both of which are common symptoms of ovarian cancer. As the cancer progresses, the body starts using more energy to fight the disease, which can lead to weight loss. Further, the spread of cancer cells can interfere with the way your body processes food, leading to a decrease in fat and muscle mass. Many people may initially welcome weight loss, especially if they've struggled with their weight in the past. Still, it's important to recognize that unexplained weight loss can indicate something serious is happening in your body. You must see a doctor if you're losing weight and can't explain why, especially if it's more than 5% of your body weight in a short period. Unexplained weight loss, when combined with other symptoms like bloating, pelvic pain, or changes in urination, can be an early indicator of ovarian cancer and should not be ignored. 4. Urgent or frequent urination. Feeling the need to urinate more frequently or urgently than usual can be a sign of ovarian cancer. This happens because a growing tumor in the ovaries can press on the bladder, reducing its capacity and making it feel full more quickly. You might notice that you're going to the bathroom more often during the day, and even waking up at night to urinate. Sometimes, you may feel an urgent need to go, but then pass only a small amount of urine. While frequent urination can be caused by other more common issues such as a urinary tract infection (UTI) or overactive bladder, it's important to consider this symptom in the context of other changes in your body. Women often dismiss this sign, especially if they've had children or are getting older, because these factors can also contribute to urinary changes. However, if you notice a sudden and unexplained increase in the frequency or urgency of urination, especially if it's accompanied by other symptoms like pelvic pain or bloating, it's a good idea to see a doctor. 3. Difficulty eating or feeling full quickly. One of the subtler signs of ovarian cancer is difficulty eating or feeling full quickly after beginning a meal. This symptom occurs because the growing tumor can press against the stomach and intestines, reducing the amount of food you can comfortably eat at one time. You might start a meal feeling hungry, but after just a few bites, you suddenly feel full, or even bloated. This sensation can be accompanied by nausea or discomfort. Many women may brush off this symptom, thinking it's due to changes in diet, stress, or even aging. However, if you constantly find yourself eating much less than usual and feeling full very quickly, it's something to pay attention to. This symptom is particularly concerning if it's paired with unintended weight loss. The combination of these signs suggests that the body is trying to signal that something is wrong. While many other conditions can cause similar symptoms, such as acid reflux or a stomach ulcer, if this change in appetite persists, talk to a doctor. 2. Pelvic or abdominal pain. Pelvic or abdominal pain that doesn't seem to have a clear cause can be another early warning sign of ovarian cancer. This pain may start off mild, feeling like cramps or discomfort in the lower stomach or pelvic area, but it can become more intense over time. The pain is often persistent and may feel sharp, dull, or achy. However, this pain is different from the temporary cramping some women experience during menstruation. The discomfort linked to ovarian cancer doesn't follow a monthly cycle and tends to worsen as the cancer progresses. This pain is caused by the tumor growing and pressing against organs in the abdomen, as well as by the spread of cancer cells to other tissues. Some women may also experience pain in the lower back or thighs, as the cancer affects nerves and other structures in the pelvic area. Unfortunately, because pelvic or abdominal pain is common in conditions like irritable bowel syndrome, IBS, or urinary tract infections, UTIs, it's often misdiagnosed. However, if this pain is new, severe, or lasts more than a few weeks, it's important to seek medical advice. 1. Abdominal bloating. Abdominal bloating or swelling is one of the most common signs of ovarian cancer that many women overlook. This symptom occurs when fluid starts to build up in the abdomen, a condition known as ascites, which is often caused by the spread of cancer cells. The bloating can make your stomach feel tight, full, or noticeably larger than usual, similar to how you might feel after eating a large meal. However, the bloating linked to ovarian cancer doesn't go away and may get worse over time, even if you haven't eaten much. Many people initially think it's due to overeating, indigestion, or weight gain, but when the bloating persists and becomes uncomfortable, it's a red flag. This symptom can also be accompanied by a feeling of heaviness in the lower abdomen. Because bloating is a symptom of many less serious conditions, it's often ignored until it becomes severe. However, you should consult a healthcare provider if you experience unexplained and persistent bloating lasting several weeks. Early detection of ovarian cancer can significantly increase the chances of successful treatment, so recognizing and acting on this symptom is essential. Thank you for taking this important step toward safeguarding your health. Awareness is the first line of defense, and by recognizing these warning signs, you're empowering yourself and those you care about. If this video resonated with you, or you think it could help someone you love, please hit that like button and share it widely. Together we can raise awareness and potentially save lives. Remember, early detection isn't just about catching a disease, it's about embracing a future filled with health and possibility. Listen to your body, take symptoms seriously, and never hesitate to seek medical advice. For more life-changing health tips, practical advice, and empowering information, subscribe to Healthy Care and hit the bell icon. You'll always be the first to know when we release new videos that can help you live your healthiest life. Thank you for being part of this incredible community. Your health matters, your voice matters, and your actions can make a difference. Stay vigilant, stay informed, and we'll see you in the next video. Take care.